Okay, so this is just a really quick overview of coronary artery disease, and of course we're talking about the arteries that are in the heart that feed the heart muscle directly. So really, coronary artery disease starts with atherosclerosis, and atherosclerosis is simply the fatty deposits that harden the coronary arteries over time. So fatty deposits in the coronary arteries, which we know can be seen in people as young as 15, continues to be this progressive problem unless it's treated with diet, exercise, and medications. These fat deposits can affect any artery in the body, so certainly even your peripheral arteries, but it really likes the heart best. And this is a progressive disease, so it's going to continue to get worse if we don't treat it properly. So the risk of developing atherosclerotic coronary vascular disease is really related directly to the levels of blood cholesterol. And when we're talking about blood cholesterol, you have your total cholesterol, but really what's the most important is actually your low-density lipoproteins, or your LDLs. So by reducing the levels of LDLs, we can actually slow the progression of atherosclerosis, which again reduces the risk of any serious coronary artery disease or cardiovascular event, right? We're really talking about people having MIs or having strokes because of plaque that has either occluded the arteries or broken off and traveled. So the best way to lower your LDL is actually a combination of diet and exercise, and then we can use medications to help lower the cholesterol if diet and exercise alone are not helping. So how does coronary artery disease or atherosclerosis actually develop? So it starts with fatty streaks of lipids that actually begin to form, and you'll see them right here. You get these fatty streaks of lipids that form under the endothelium. So when you think about your blood vessel, if you can see here, the interior lining is called the endothelium. So these lipids seep into the endothelium and they create this plaque that forms over time. This is going to continue to worsen unless we treat it properly. So fibrinous plaques begin to develop, and over time, the body or the endothelium becomes injured. And this is just normal wear and tear on the body. People smoke. Think about smoking, diabetes, if you get an infection, if you have inflammatory problems like you have vasculitis because of lupus, or anything that kind of happens, the endothelium, the lining gets injured, and the body tries to repair itself, right? I mean, you try to have clot formation, you try to have platelets come to the area, but when you have coronary artery disease, it becomes less, that process becomes less effective. So time allows for LDLs and platelets to thicken that arterial lining or that arterial wall. And then other cholesterol and other lipids will begin to migrate to the area. And because there's injury there, you're going to have all your cellular processes happening in inflammation. Your macrophages come to the area, you wind up getting cellular debris from breakdown and trying to heal this, this injury that's happened. And that all begins to stick and begins to form even more plaques. And so what happens is you get narrowing of the coronary artery, or narrowing of the lumen. And when you have narrowing of the lumen, you have less blood flow to that area. So fibrinous plaque over time continues to grow. There's continued inflammation that causes that plaque to eventually become unstable. Now that plaque can eventually ulcerate or rupture, and once it ruptures, it starts to leak out. And platelets, because there's now a tear in that lining, platelets will come to the area. They want to fix that hole, right? That's their normal process. They become activated, and that's what creates a thrombus to form. So the platelets come to the area, they stick to this plaque that's kind of down there, and they create a thrombus. This narrows the lumen even more, or it can totally occlude it. So if you have a slow process that's occurring, this thrombus can break off and travel. That could create that could travel to the brain, and someone could have a stroke. You could have symptoms of angina if there's still a little bit of blood flow, but for the most part, you have this big, blood clot in there. Or the most serious, of course, is to have a complete occlusion of this coronary artery, and that cause a myocardial infarction, right? Because the myocardium needs oxygen, it needs blood flow, and when the artery becomes occluded, you're not going to have the coronary artery, that the area of the heart that it's feeding is not going to get blood, and therefore it's going to die off. Now, if this is a slow process, the body may have time to create collateral circulation, where you have new capillaries being formed that sort of help divert blood around the area that's occluded. But you don't see that in an acute process. When this happens suddenly, there's not enough time for collateral circulation to occur. So again, your collateral circulation is an important reason why people who have coronary artery disease can live a long time and not have, a major MI, because you have diversion of blood flow around the occlusion. Right here, you have new capillaries being formed. Blood flow is able to then go around the area that's being occluded. So even when it gets totally occluded, you still have this other new network. You will see this again when you have the slow progression of coronary artery disease, but it does not happen when you have sudden thrombus formation and you have a major myocardial infarction. So that essentially is the progression of coronary artery disease and how it starts. We'll discuss more about this in class, and we'll talk more about treating cholesterol.